the last few years have been very exciting. We know that healthcare evolves and technologies become more and more complicated, and the physicians in residencies and in fellowships are learning new skills that could really benefit our community.
You see different perspectives from from not only the patients, but also how other physicians or surgeons may view an injury or the response to that injury.
So for us to be able to recruit doctors to meet the community's needs that have these new skills, able to use these new technologies, is very exciting for us.
I think it's all well and good to go to a bigger center to be trained and to learn new things and see different patient populations and different people, but I don't think it's really worth it unless you come back home and kind of give back to the community that you were from.
Interviewed multiple places all across the country, and I trained in Detroit, New York City, and in Chicago. And that brings me back to the reason why I'm here. I did interview in multiple places where I felt that patient care don't come first, money comes first, and the vast majority of the interviews were focused about revenues and income. Very little was involved in what patient care is going to be delivered.
You know, Jameson's a small community hospital. Yeah, we are, but we're growing just like everybody else. We're not on the news like UPMC every day or Cleveland Clinic. That doesn't mean that they're better and we're not. We still have just as good a care as they do.
I've been around in this neighborhood for a couple of years, and Jameson came out to be as a viable option where I can practice what I believe in, a comprehensive pain management and a multidisciplinary approach where my voice carries some weight and I can be heard and I can service the patient in a better way.
The new group of physicians coming to the community is really the legacy of the historic medical community, because physicians bring physicians and physicians welcome physicians. And the fact that they're newly trained, the fact that healthcare is evolving, I think it's a tribute not only to the new but also to the established medical community to welcome these physicians and help us recruit them in the community and work alongside of them.
We're expanding, we're getting bigger. We're adding new services, new services, not only just physician-wise, but also opportunities in the building. So I think it's nice to get on that ground level and to help out as much as I possibly can.
Our clinic, we have a lot of time to spend with the patient and establish a good rapport with them, and offer them services that they might not have had a chance to get. Some clinics are overbooked, and so they've actually been able to come to our clinic to get faster appointments and faster care.
The excitement of it all is seeing the Lawrence County community benefit. When you have family and friends that do not have to leave this community for their care and high quality care, it helps to their recovery process. It helps those families mentally, because families don't like to be separated from their loved ones.
My basic approach is treating people the way I want to be treated. I had said before, I treat patients like I would my family, my mom or my dad, and I use that type of approach. The more specialists there are, the better it is for patient care right here in this area. And so the patients don't have to leave the area and they get good quality care here.
The key role of having intensivists in local areas is to provide quick care really to critically ill patients. Rather than having them transferred out to different regions which are far away, maybe about 45 to an hour, even a helicopter flight.
Every physician in every institution in the country has limitation. No matter what hospital you are, there's always limitation. And once you understand those limitations, you understand when the patient needs something above and when is the patient fine to be taken care of in-house. And that's where basically we shine, is we tend to understand the institution and all the capacities we have and know what we need to do for the patients to get better.
Of treating cancer and patients is the communication and the social and the moral support, which is very important. Being with the patient from the start to the end, that's very helpful, and to see a familiar face every time, that's really important.
You'll be a little bit more close and familiar with all your patients, which is great for the physician. Give them a chance to bond with the physician, with the patient and the families as well.
It's the same surgeon that sees the patient in the office, the same surgeon that is going to perform the surgery and then follow the patient during the whole admission in the hospital. We don't have any training residents or any junior staff to follow the patient for us. We are the ones seeing the patient day one. We are the one following until the patient until the whole process finish.
Yeah, we've become a lot more aggressive with education because that's the biggest battle is getting the patients educated. And the diabetes center as well as the wound care center, we give out educational material, as well as my office, which is right next to the wound care center, so we give out educational material. But yeah, we get a lot more aggressive with treating these wounds and taking care of the patients a lot sooner.
I think that they need to know that someone cares about them, and I think that helps in the process of gathering information and being able to treat the patient as best we can.
Clearly, we're here to meet the needs of the residents of Lawrence County. All of the things we do to help to coordinate the care, to help provide the facilities for care, is really a collaborative effort between us, the independent doctors, and the new doctors coming on board as part of the Jameson Health System.